In December 2019, the Chinese authorities notified the world that a virus was spreading through their communities. In the following months, it spread to other countries with cases doubling within days. This virus is the Severe Acute Respiratory Syndrome-related coronavirus 2 that causes the disease called COVID-19 and that everyone simply calls coronavirus.
On a Friday morning, I woke up early in the morning with a fever of 100.4 degrees.
I just felt feverish, chills, body aches all over.
Fever, body aches, chills, all the stuff that you're kind of hearing. I started getting the cough, everything with it.
And so I figured I had an obligation not only to my colleagues and our staff here at the City of Tempe, but my family and members of the general public in my position to make sure that I got a test. And the results came back in about roughly 36 hours, and it came back saying that I was positive.
I have a baby at home and a wife. She got it about 2 days after me, and she definitely had that tell sign of COVID where you just feel like your breathing's restricted and more of a cough and more difficulty breathing than I had. But yeah, unfortunately, we took all the precautionary measures and we still got it. So I would say it doesn't matter your age, your fitness level, the type of healthy precautions you take at home and in your personal life, everyone's susceptible to getting it.
That's one of the biggest things that I've heard from patients. They come in and the younger, the 20 to 50 year olds, they'll even tell us that they thought it was kind of a joke and they didn't pay any attention to it, and now they have it. Just check yourself. If you feel a little sick, you feel like you have a fever, don't let it go, get in and get some. There's so many testing sites. Go to your family practice doctor. There's just no reason not to, get in tune with this disease because it is critical.
I tell people all the time that I'm not exactly sure how I got this. The reality is it only takes one time. The one time you don't have your mask on and you happen to be in an environment with somebody who might have it or might be asymptomatic. And so that's all it takes.
We always say, it's kind of like a ghost because we have no idea how we got it in our family here. We don't know where it came from. We don't know why it happened to our family.
We were taking every precaution possible. We were wearing masks. We were washing our hands. We were doing everything. So kind of like my mom said, it's a ghost. Like you really don't know where it comes from. And it really hit our family pretty hard and it really hit home. And it's harder for people to understand that haven't lived through losing a family member to COVID. And it wasn't just a family member, it was my dad, and he's supposed to be here for all these later memories in my life, and he's supposed to meet my kids, and it wasn't fair, and it's not fair that this happened to our family when we took every precaution absolutely possible. So I think that one thing I would definitely say is it's not just about you. It's about now my mom, and it's about my brother, and it's about my grandma and my grandpa, and it's about all these people out there that you could potentially be putting at risk. It's a bigger picture than what people are kind of making it seem to be.
At the beginning when this first came about and you're hearing of these things, it always seemed like, here are these numbers and here are these numbers and it's these people. Well, now it's us, it's our family. It's been affected. Take it from us, it is painful. It's very painful to see someone have to go through that.
While this is a very challenging, difficult time for all of us to get through, it's also an opportunity to do some big things and create real institutional change. Because my perspective is this is a very tough thing to go through for all of us. But I really wish during this kind of time, we would stop trying to fight each other and we would actually focus more on saying, look, let's all try to love one another, take care of one another, and agree that there are some things that we can actually do to really stop the spread and really band together and address the issue. If all someone like myself or the city government or Maricopa County or the state of Arizona is asking you to do is to wear a mask when you go out to your favorite grocery store or to a department store or to wherever you might happen to be during any given day, it is the smallest thing you can possibly do to keep yourself safe and the others around you. And I would just ask that you do it because together, if we actually band together and lock arms and agree on a uniform set of public health principles, we can beat this thing together.